different. What things would you all recommend for folks to kind of strengthen their immune system, so that they are, better prepared, that we are, thinking more in a healthy manner? Maybe that'd be a positive thing that can come out of this coronavirus thing, is that people begin to obviously take better care of themselves from a hygiene perspective, be mindful of kind of surfaces that they're touching. Those are positives. But I think it's also an opportunity for people to start to explore with a real emphasis on how they can better strengthen their immune system.
Well, Dr. Audrey mentioned. Go ahead, Dr. Audrey.
Well, just have a well-balanced meal, nutrition. If you have to have a supplement or take vitamins, take that. That would helpfully improve your health. Help eating a well-balanced diet with fruits and vegetables and minimal meat. But some people, diet consists of more meat than vegetables. You just want to make sure that you just eat properly. Have the meat should be the least amount on your plate. But now with the coronavirus, it might be harder to get vegetables and fresh fruit because people might be quarantined or people can't go out. So you're going to have to rely on frozen and canned foods, things that you have in stock in case you can't get out. But the main thing is to eat a well-balanced diet. If you have to take some type of vitamin or supplement, go ahead and do it.
Okay.
And I make sure, of course, exercise. You probably have to walk, exercise in your house. So you always want to make sure you boost your immune system, like Dr. Albright was talking about, using zinc. There's controversy over it, but, certain supplements do help.
What's the controversy?
To boost your immune. Huh?
What is the
just
controversy?
Just like vitamin C. It doesn't, for some people, it doesn't work. They don't see an improvement. It depends. It depends on, so some people say it do, some scientists say it don't, just like vitamins and supplements. There are two rules of thought. Some scientists like it, some health professionals don't. But we know that vitamins do work. We do know it working in some individuals. So, and the thing is just you have a healthy strong immune system. And if you do have a compromised immune system, you can't go out. You're going to have to just stay in.
Wow. Well, I tell you, Dr. Audrey, the various things that people are doing out here, when I hear you talking about the vitamins and those types of things, I've heard everything this week from, even the type of clothing people wear. And I'm not kidding. In terms of these are ways to keep yourselves from getting this thing through skin-to-skin contact and all kinds of other things. But from a medical perspective, from the reality, from you and Dr. Albright's perspective, what can a person expect? For example, let's say, Joe goes to the hospital. He's not feeling well. He's got some flu-like symptoms. And what can Joe expect to happen to him when he walks through the door?
Well,
go ahead, Dr. Albright.
Well, I think there are two perspectives that Mike is saying. And one, Mike, would be if they go to a dental office or a private medical office versus the hospital. And I would say that I would imagine that as time goes on, like Dr. Audrey mentioned earlier, that the clerk or the secretary in the office is probably going to become more of a screener. And if somebody's sitting in the lobby coughing or something, they'll probably ask them to head on over to the ER or urgent care so that they can be screened to see if they do have something that's going to be harmful, because we're going to become less tolerant of somebody who's obviously sick coming to work or, being in your office or around you. People are going to just naturally become more reticent to having those people around. But if you go to the emergency room and you have flu-like symptoms, expect to be screened for the coronavirus. But, again, this is not anything that we're going to be, the hospitals are trying to control panic so that, people aren't, because, this thing can get to the point where people become violent when somebody's around them that's not well. And we certainly don't want anything like that to become, common. But what we need to do is just, like I said, precaution. Keep yourself from contracting the virus because you're going to give it to you. And going out and all this stuff, just keep your hands to yourself, keep your hands clean, and remember how the virus is transmitted. Like, again, I think that the education has been lacking in terms of getting this information to the public. Everybody should know that the virus is on surfaces, and when you touch surfaces and put it in your face, you're going to give yourself the virus. That I don't hear that nearly enough in terms of how everybody's afraid of getting it, but nobody's asking or being told how you get it and how not to get it. And we're trying to get that message out on your podcast. But I think that's probably the most important public health issue right now is how can you prevent yourself from contracting this virus? And that is by, not giving it to yourself, understanding where the virus is and how not to put it in your body.
So what would happen and how do they get to the point where they say, okay, Mr. Smith, you have tested positive? What does that process look like? And then what happens from that point?
Okay, well, this process is brand new and it's being developed as we speak, Mike. The hospitals are forming teams and, obviously you can't quarantine everybody, but, if you test positive for the virus, then quarantine is, the next step because we know that you're infected, and not only quarantine for you not giving it to other people, but also quarantine to see how fast or how quickly it's going to affect you and how ill you're going to become. So these are things that are being working out at the hospital. I was in the hospital today and the medical director was telling me that, we're meeting all day, every day, trying to put these teams together and these action plans together so that we, at my hospital, they haven't had a case yet. So we're gearing up to be prepared for when somebody is positive, what are we going to do? Because this is fairly new and it's just getting to the United States. So we're working in China. The information coming out of there is not reliable because obviously they don't want people to really know how bad it is. And so we can just rely on what they're telling us and from what the medical professionals that get out information, they have to be very careful about doing that in China because it could end very badly for them. But the things I hear are saying that it's much worse in China than they're letting on because they don't want the rest of the world to be afraid to deal with them and Chinese people can't do this and that. So we just have to be vigilant. We understand the virus. We understand what we're dealing with. Now we just have to put precautions in so we don't, infect ourselves. And if we do that and panic, I think we'll be much better off.
But what happens, because they're saying, what if you don't have insurance? That's another concern, people who don't have health care, because people will be charged. And if you can't afford to go to the hospital, what are you going to do if you're infected with the coronavirus?
Right.
And that's another concern.
Right.
Well, in this country, it is illegal for the hospitals to deny care to someone who is ill. I've been taking care of women with no insurance for 30 years. They all get the same care as somebody with Blue Cross Blue Shield. Okay. So it's not going to be a situation where the hospital is going to be out there in front saying, if you don't have a medical card, get away from here. They can't do that. It's illegal. So I don't think people should panic any more than usual if they don't have insurance. If they get sick, they're still going to come to the hospital. Hospital's still going to have to take care of them. So again, the issue, the most important thing for everybody is to not contract the virus in the first place. And that can be done by keeping your hands clean, sanitized, and out of your face, out of your mouth and nose.
What do you, and I don't have a crystal ball. I know nobody else does either, but we hope to get behind this, we'll get this behind us as quickly as possible. How does, is this something that is still affecting us? Do you think by when the summer gets here, or is, I can't remember. I remember, I'm thinking back to the last thing that they talked about as a pandemic. I don't know if it was it H1N1 or something like that. I think was the last thing I remember hearing folks talking about, and it was talked about, and then it wasn't, and then I didn't hear about it again. And this virus, do you think this is something that will be something we'll be talking about into the summer in the same way, or do you think people will finally get the message and it'll die down some because they're taking the proper precautions? I mean, I know that's what I'd hope in a perfect world that we're not talking about it at that point. But is that realistic? Is that pie in the sky? Or
well, let me give you an example of a
question.
virus that when it first came on, everybody who got the virus died. You remember that virus? HIV?
Oh, wow.
Uh-huh.
Now,
right.
Okay. Everybody that got it died. Now, very few people are dying from it because now multiple medications have been developed, and we can basically get a patient's lymphocytes down to undetectable, i.e. Magic Johnson. So something that comes on and kill, it's a terrible thing right now. It's killing lots of people right now. However, like I said in the article that I read, there's already a tremendous amount of information known about this virus, and they're working on vaccines, et cetera, but it takes a while to develop a vaccine. It's not something that happens overnight. So the experts said it's not going to happen right away. And until it does happen, the virus, unless we use public health and, proper hygiene, it's going to continue. But eventually, we will come up with vaccines and, medications that can curtail the virus. But right now, we're trying to keep it from being a pandemic, of massive proportions. And right now, the only way to do that is for us to take a public health approach and a sanitary approach and keep this virus. It would be different if we didn't know anything about how people getting it. We didn't know. We know that it only can get in your body if you put it in there. So that's the take-home message. And all the sanitation, all the bottled water is not going to help unless we do this common sense public health issue, just cleaning your hands, wiping down surfaces where you working or where you living to keep the virus out of your system. And if we do that right now, that's the only thing that's going to help us, because there's no medicine for it, as you stated earlier. So the key point, keep it out of your body.
I like that one. I like that. Chief, what you got?
Well, I tell you, this has been a very informative show. I know that. Well, I tell you, Dr. Albright, you made me feel good until you brought up the point about the water, because my wife had me buy so much water, I had to put some of it on layaway. So,
like I said, all you do, Mike, is say, baby, what is this water going to do? Why do we need so much water? Because it's
going to hose him down.
Without the faucet. She going to dash you in the face with the water. See, it's just a panic thing. And fortunately, Mike, it's not necessary. or it just costs you some money.
Yeah.